Radiation therapy is received by every second cancer patient in this country. The side effects are that normal tissues also are affected by radiation. When ionizing radiation interacts with living cells, for example, living cells in our bodies, it produces very damaging short-lived radicals, tiny molecules, which are nevertheless capable of damaging the cells and DNA. Melanin is a natural pigment and it occurs everywhere, practically in nature. So what melanin does, first of all, it prevents the formation of these free radicals, and second, if some of them do form, it catches them and does not allow them to spread inside the body. We have to package melanin in nanoparticles because melanin is insoluble pigment. So we cannot inject it into people as a solution, as it is done with most of the drugs. So we had to make very small particles of nano range, nanoparticles. In this case, if such nanoparticles are injected intravenously into a patient, many of them will go into the bone marrow. Once they're in the bone marrow, they will be there for some time. So the idea here is to give those nanoparticles to patients before they're subjected to radiation treatment. After we injected nanoparticles and we exposed our mouse model to the radiation, we observed two very important things. The tumors were shrinking, which is good. So the mice were getting healthier, and their bone marrow was better protected, so their blood chemistry, which we checked several days after radiation, was much better than in those models which were not protected with melanized particles. Our study was published in the International Journal of Radiation Oncology, Biology and Physics, and our central findings are that melanin in form of nanoparticles is capable of protecting bone marrow from both external radiation, so-called external beam therapy, which a lot of people undergo when they have cancer, and also from internally administered radiation. The tumors were not protected. The important implication of this study is that we can increase the dose given to the patient's tumor, to be more precise, and thus make the treatment much more efficacious, but we can protect their bone marrow simultaneously because it will be purged with nanoparticles before treatment is given.